This is the Bible Forum. It's Sunday night. Maybe not where you are today, but it is night now. I want to talk to you about nose swabs and COVID. This is stimulated by an article I found in zerohedge.com. Apparently, when they swab your nose, it's called a PCR test. The PCR swab collects RNA from your nasal cavity. The RNA is then reverse transcribed into DNA. And what does the PCR test actually tell us? As it turns out, very little. The genetic snippets are so small, they must be amplified in order to become discernible. And each round of amplification is called a cycle. Amplification over 35 cycles is considered unreliable and scientifically unjustified. And yet, Drosten tests, as well as tests recommended by the World Health Organization, are set to 45 cycles. Now, this is probably why we read about people, hear about people receiving opposing results in the same week or even in the same day. I told you about the man several weeks ago, a fairly prominent man who got tested twice a day the whole time he was at this conference. And every day he was either positive or negative, sometimes within the same day. What this does is amplify even insignificant sequences of viral DNA that might be present to the point that the test reads positive, even if the viral load is extremely low or the virus is inactive. As a result of these excessive cycle thresholds, you end up with a far higher number of positive tests than you would otherwise. Before his death, the inventor of the PCR test, somebody named Kary Mullis, repeatedly yet unsuccessfully stressed that this test should not be used as a diagnostic tool for the simple reason that it's incapable of diagnosing a disease. Yet Mike Yeadon, former vice president, scientific director of Pfizer, has even gone on record stating that false positive results are unreliable PCR tests are being used to manufacture a second wave based on new cases when the fact of a second wave is highly unlikely. Perhaps most importantly of all, the PCR tests cannot distinguish between inactive viruses and live or reproductive ones. And what all this means is that the PCR test cannot detect infection, period. It cannot tell you whether you are currently ill, whether you'll develop symptoms in the near future, or whether you're contagious. Now keep in mind, an infection is when a virus penetrates into a cell and begins to replicate. As the virus multiplies, the symptoms set in. A person is only infectious if the virus is actually replicating, not if it's present. As long as the virus is inactive and not replicating, it's completely harmless, both to the host and to others. Now, the chances are, if you have no symptoms, a positive test simply means it has detected inactive viral DNA in your body. This would also mean that you're not contagious, that you don't pose any risk to anyone. For all of these reasons, a number of highly respected scientists around the world are now saying that what we have is not COVID-19 pandemic, but a PCR test pandemic. In his September 20th, 2020 article, Lies, Damned Lies, and Health Statistics, The Deadly Danger of False Positives, Yeadon explains why basing our pandemic response on positive PCR tests is so problematic. The October 28 article featured by the Ron Paul Institute points out that fact. It says, ever since the alleged pandemic erupted this past March, the mainstream media has spewed a nonstop stream of misinformation that appears to be laser focused on generating maximum fear among the citizenry. But the facts and the science simply don't support the grave picture painted of a deadly virus sweeping the land. Yeah, we do have a pandemic, but it's a pandemic of ginned up pseudoscience masquerading as unbiased fact. Why? Number one, a positive test is not a case. This was explained by Dr. Lee Merritt in her August 2020 Doctors for Disaster Preparedness lecture, featured on how medical technocracy made the pandemic possible. Media and public health officials appear to have purposely conflated cases or positive tests with the actual illness. Medically speaking, a case refers to a sick person. It never referred to someone who had no symptoms of the illness, but tested positive. Now, all of a sudden, this well-established medical term, case, has been completely and arbitrarily redefined to mean anyone who tested positive for the presence of viral RNA. And as noted by Merritt, this is not epidemiology. This is fraud. Secondly, according to the CDC 34 and other research data, 35, the COVID-19 survival rate is over 99%. And the vast majority of deaths occur in those over 70, which is close to normal life expectancy. Thirdly, CDC analysis reveals 85% of patients testing positive for COVID-19 wore face masks often or always in the 2 weeks prior to their testing positive. As noted in the Ron Paul article, the only rational conclusion from this study is that cloth face masks offer little, if any, protection from COVID-19 infection. Number 4, there are inexpensive, proven, successful therapies for COVID-19. Examples include various regimens involving hydroxychloroquine with zinc and antibiotics, quercetin-based protocols, and the MATH Plus protocol, along with the nebulized hydrogen peroxide. Number 5, the death rate has not risen despite pandemic deaths. Data shows the overall cause mortality has remained steady during 2020 and doesn't veer from the norm. In other words, COVID-19 has not killed off more of the population than would have died in any given year anyway. We are simply reading about them all. As noted in the Ron Paul article, quote, according to the CDC, as early as May 2020, the total number of deaths in the U.S. was 944,251. That's from January 1st to April 30th. This is actually slightly lower than the number of deaths during the same period in 2017. That's when 946,067 total deaths were reported. The declaration points out that current lockdown policies will result in excess mortality in the future, primarily among younger people and the working class. As of November 5, 2020, the Great Barrington Declaration had been signed by 11,791 medical and public health scientists, 33,903 medical practitioners, and 617,685 concerned citizens. What is the Barrington Declaration? Here it is. Fortunately, our understanding of the virus is growing. We know that vulnerability to death from COVID-19 is more than 1,000-fold higher in the old and infirm than the young. Indeed, for children, COVID-19 is less dangerous than many other harms, including influenza. As immunity builds in the population, the risk of infection to all, including the vulnerable, falls. We know that all populations will eventually reach herd immunity, that is, the point at which the rate of new infections is stable, and that this can be assisted by, but is not dependent upon, a vaccine. Our goal should therefore be to minimize mortality and social harm until we reach herd immunity. The most compassionate approach that balances the risks and benefits of reaching herd immunity is to allow those who are at minimal risk of death to live their lives normally, to build up immunity to the virus through natural infection, while better protecting those who are at higher risk. We call this focused protection. I would add that this is pretty much what we've always done. Adopting measures to protect the vulnerable should be the central aim of the public health responses to COVID-19. By way of example, nursing homes should use staff with acquired immunity and perform frequent PCR testing of other staff and all visitors. Staff rotation should be minimized. Retired people living at home should have groceries and other essentials delivered to their home. When possible, they should meet family members outside rather than inside. A comprehensive and detailed list of measures, including approaches to multi-generational households, can be implemented as well and is well within the scope and capability of public health professionals. Those who are not vulnerable should immediately be allowed to resume life as normal. Simple hygiene measures, such as hand washing and staying home when sick, should be practiced by everyone to reduce the herd immunity threshold. Schools and universities should be open for in-person teaching. Extracurricular activities such as sports should be resumed. Young, low-risk adults should work normally rather than from home. Restaurants and other businesses should open. Arts, music, sport, and other cultural activities should resume. People who are at risk may participate if they wish, while society as a whole enjoys the protection conferred upon the vulnerable by those who have built up herd immunity. Close to 50,000 scientists and others signed this document. Have you ever heard of it before? Have you heard any of this before? Do you realize how controlled our media is? It's okay, as long as you know it.